Vaccination is the #1 way that we can prevent measles.
That is Connecticut's top health official just a day after the state's first reported measles case in 4 years.
Now, the infectious disease was declared eliminated back in 2000 here in the U.S., but there's now been a resurgence. Your reporter Dylan Fearon live from the Department of Health in Rocky Hill as officials here reminding parents to get their children the vaccines. Dylan?
Well, Mark, Aaron, there have been more than 1,900 cases around the U.S. just this year. That's more than in the last 30 years, in the last 3 decades, I should say. The one case in Connecticut right now is at a Trumbull over in Fairfield County, where that child right now was unvaccinated.
We are working with the family to be able to help determine all the elements of contact tracing that we will need to do.
Connecticut is investigating its first reported measles case since 2021. The unvaccinated child traveled internationally recently and showed symptoms of measles several days later.
What we've seen this year is more sustained transmission around the country, around other countries where people have gone to, particularly our neighbors, Canada and Mexico.
Public Health Commissioner Manisha Jutani doesn't want parents panicking over measles, but admits with declining vaccination rates around the country, everyone is at risk at some level. A typical case of measles begins with a cough, runny nose, congestion, and fever, eventually leading to a head or face rash. The Department of Public Health recommends 2 doses of the measles, mumps, rubella vaccine, the first between 12 and 15 months, the second between 4 and 6 years old. Karen Booth is an Enfield mom, 2 kids, who both received the MMR vaccines.
Years ago, I mean, I'm older, it wasn't even a thought. Everyone had them, the vaccines, from, babies on, and there just wasn't the issues you have today.
There have been more than 1,900 reported measles cases in the U.S. this year, the most in more than 3 decades.
Unfortunately, given our declining vaccination rates as a country, we are all at risk at some level.
In Connecticut, more than 98% of students were vaccinated before kindergarten, the highest rate in the country, compared to 92% nationally. Janet Schloss in West Hartford believes every parent needs to have their child vaccinated.
It's a national problem, and that can't keep. Just because we're vaccinated here doesn't mean that we're not susceptible to the decisions of others. We're supposed to be one country.
Roughly 20% of unvaccinated people who contract measles need to be hospitalized. The mortality rate in the U.S. is less than 0.3%, according to Harvard Health. Yeah, Mark, Aaron, there have been 3 measles-related deaths in the U.S. just this year. I'm your reporter live in Rocky Hill tonight, Dylan Fearon, Channel 3 Eyewitness News.